Hi, I'm Dr. Amar Chauhan from Medisimuhub. This is a manikin simulation-based education company, and today we are going to learn. We are going to do a CPR simulation, where our learning objective will be how to do a high-quality CPR, how to use an AED, and most importantly, how to work as a team in a coordinated manner when we are doing actual CPR in real scenario. So these are our objective, and this is our team. I have briefed them about the our course objective, our expectation, and what we are supposed to learn. And after the simulation is over, I will do the debriefing, because that is the time when the real learning takes place, when the learner himself reflects upon his learning and help the instructor to analyze his or her action. So CPR is otherwise a very pretty basic skill, but when it comes to real life scenario, then it becomes very chaotic. So today we are going to find out what are those gaps, performance gaps, which prevent us performing as a good team, or applying good team dynamics. So this is the scenario of the cardiac arrest after the hospital. Although the simulation is taking place in a hospital, and this kind of simulation is called in situ simulation, where the scene is real, the performer are real. So this is an in situ simulation, but we have kept the scenario after the hospital cardiac arrest. So this is our team, and we will just start the CPR. So this is the scenario. One gentleman has collapsed in the park, and somebody has come to him, and he is going to lead us to the simulation. So this is the patient who has just arrested in the park, and he was taking a stroll. And you please proceed for the simulation.
Okay. सबसे पहले हम देखेंगे सीन सेफ्टी.
Oh, scene is safe.
Here scene is safe. तो second thing we should check response. पेशेंट का हम रिस्पॉन्स चेक करेंगे कि वो कितना रिस्पॉन्स कर रहे हैं. तो उसके सबसे पहले कंधे पर हम टैप दबाएंगे, उससे पूछेंगे कि भाई साहब कैसे हो आप. तो भाई साहब कैसे हो आप.
No response.
भाई साहब तो नो रिस्पॉन्स. उसके बाद हमें कैरोटिड पल्स फील करनी है.
So we'll feel the carotid, very good.
तो वो 5 से 10 सेकंड तक करनी है. उसके साथ साथ चेस्ट की मूवमेंट देखनी है, ब्रीदिंग कर रहा है कि नहीं कर रहा. तो जैसे
So no pulse, no breathing.
नो पल्स नो ब्रीदिंग. उसके बाद जो चेस्ट है उसको एक्सपोज करेंगे ताकि सीपीआर हम अच्छे से कर सकें. सीपीआर करने के लिए, कंप्रेशन करने के लिए जो लोकेशन है वो दोनों निपल्स के बीच में और मिड स्टर्नम पे होनी चाहिए. और इसके लिए जो कंप्रेशन करेंगे वो 2 इंच डीप, यानी कि 5 से 6 सेंटीमीटर डीप, और वापस
Oh yes, 5 to 6 centimeter you mean to say should go inside. Okay.
वापस रिकॉइल करनी चाहिए. उसके पहले हम जैसे सीपीआर स्टार्ट कर रहे हैं, उससे पहले हम एम्बुलेंस के लिए कॉल फॉर हेल्प करेंगे. जैसे कोई भी अननोन पर्सन है तो हम
Okay, shout for help.
हाँ, शाउट फॉर हेल्प. जैसे भाई साहब एम्बुलेंस को फोन करिए और साथ में एडी मशीन लेके आए. ओके. हेलो
Hello.
एम्बुलेंस सर्विस.
Yes.
मैं रजनीश कुमार बोल रहा हूँ.
Okay.
एक पार्क में एक अंकल को कार्डियक अरेस्ट हुआ है. आप
Okay.
एम्बुलेंस के साथ में एईडी मशीन लेके आए.
Okay. Where is your location?
सर पार्क होंडा चौक पे.
Okay. We will be right there. Thank you.
जो सेकंड पर्सन है वो एम्बुलेंस को कॉल करते हैं, तब तक आपने सीपीआर स्टार्ट कर देनी है. उसके लिए जो लोकेशन होगी सीपीआर की वो
You have told us that start CPR.
उसके लिए जो हैंड की पोजीशन है वो जो पाम है उसकी हील से हम प्रेस करेंगे, जो फोर्स है वो लगाएंगे, और जो एल्बोज हैं वो हमारी स्ट्रेट रहनी चाहिए. जो फोर्स लगेगा वो शोल्डर से लगेगा. तो लाउडली काउंट करते हुए हम सीपीआर स्टार्ट करेंगे. 30 कंप्रेशन करने हैं विद इन 15 to 18 सेकेंड्स. जो हमारी फिंगर्स हैं उसके लिए सीधी रहेंगी. 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20 21 22 23 24 25 26 27 28 29 30. तो हमें इस तरह 30 कंप्रेशन करने हैं. उसके बाद हमें पेशेंट को रेस्क्यू ब्रीथ देनी है। ये पॉकेट मास्क है जो पॉकेट में अवेलेबल होता है, उसके लिए इसकी हेल्प से हम पेशेंट को ब्रेथ देंगे। ब्रेथ के लिए पहले जो पॉकेट मास्क की पोजीशन है वो ऐसे होगी, इसमें C एंड E की पोजीशन होनी चाहिए ताकि हम इसको अच्छे से होल्ड कर सकें। और जो पेशेंट का जो हेड है वो पीछे टिल्ट करेंगे और 2 रेस्क्यू ब्रेथ देंगे। एक ब्रेथ 1 सेकंड में।
So the ambulance crew has arrived.
दो रेस्क्यू ब्रेथ देने के वापस से हमें CPR करनी है, CPR स्टार्ट कर देनी है। फिर से 30 कंप्रेशंस, सेम पोजीशन। 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20 21 22 23 24 25 26 27 28 29 30। अब जो रेस्क्यूअर है वो थक जाता है तो कॉल फॉर हेल्प बोलेगा। जो एम्बुलेंस की टीम है उसके साथ में जो जाते हैं उनके लिए बोलेगा कि आप CPR करें।
Shot advised. Charging.
1 2
Stay
3
clear
4
of patient.
और क्लियर।
Deliver shock.
Patient को कोई
now.
touch नहीं करेगा।
Press the orange button. Shock delivered. Pause.
1 2
Start
3
CPR.
4 5 6 7 9 10 11 12 13 14 15 16 17 18 19 20 21 22 23 24 25 26 27 28 29 30।
So again 2 rescue breath.
1 2 3 4 5 6 7 8 9 10 12 13 14 15 16 17 18 19 20 21 22 23 24 25 26 27 28 29 30।
You take over, Anupama. Chest compression. Be quick now.
1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20 21 22 23 24 25 26 27 28 29 30। 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20 21 22 23 24 25 26 27 28 29 30।
So this is how chest compression and rescue breaths are given and AED is applied. So after 2 minutes we always check and this patient somehow got lost and has been transferred to a hospital. So we do CPR because approximately 15 to 20% of patients they do survive when there is a chain of survival in the place. It's not like we do CPR and patient will survive. For patient to survive of cardiac arrest out of the hospital, we need to have a chain of the survival chain where we can transfer the patient to the hospital and the hospital can take care of such patients. So this is how this CPR is done. And now we will do like how do they perform. So all of you come here on this side. So you have just taken care of a patient of cardiac arrest. So how are you feeling?
Good.
So okay, that's good because we know that this was everybody knows that this was a patient of. So this is up now. I'm doing debriefing. Right, debriefing is very important where the learning takes place, where you self-reflect on your actions, you analyze your own action, rather than I just transmitting the knowledge to you. Rather than it is the time when you think like if you do something or if you did not do something, what was your thought process during that time. So we'll find out what they did well, what they did not did not do so well. So of course this was a patient of cardiac arrest, and they are happy, they are feeling good because the patient got ROSC, that is return of spontaneous circulation, and he has been shifted to the hospital. Okay, so that's a very good simulation they have done, good effort. So clap for them. So we'll just talk to our team leader, who is Dr. Amit, and when you approach the patient, did you ask for the scene safety?
जी
Okay, so we have to always ask whether the scene is safe or not, because if the scene is not safe, then we will not proceed further and we will make the scene safe for ourselves. And I thought the sequence of like the scene safety, then checking the response, and then shouting for help. You took little bit some time before you shouted for the help. So what was you thinking? What were you thinking? Like you were not immediately called the you did not shout for the help.
सर उससे सबसे पहले मैं कैरोटिड पल्स फील कर रहा था कि उसका हार्ट ओके है, चल रहा है या नहीं, ब्रीदिंग चल रही है नहीं. उसके बाद जैसे मैंने सोचा कि मैं पहले CPR की प्रोसेस समझा दूं.
And we are doing this simulation in Hindi so that maximum people can learn this CPR technique, because this is a bystander procedure, and even non-medicals can. This is the only skill where even non-medicals can do this skill and can help in saving lives. Okay.
सर मैं CPR के जो प्रोसेस है वो इसलिए समझाने लग गया था कि कॉल मैं बाद में इसलिए करने के लिए सोचा था कि मैं पहले समझा सकूं, बता सकूं कि कैसे CPR करनी है, कंप्रेशन कैसे होनी चाहिए, कितना डीप होना चाहिए और टाइमिंग क्या रहनी चाहिए. इसलिए मैंने पहले कंप्रेशन.
And did you take care of recoil of the chest when you were doing chest compression? Was that in your mind?
बिल्कुल सर.
So what is high quality compression? Like you compress the chest and then it should recoil back to its normal position, so that you can press it again. Okay. But I felt, this is my personal feeling, maybe I am not right, that you were slightly slower in your action. And you have to say like 100 to 120 per minute, not like 30 compression in 15 or 18 seconds. So I think we should say 100 to 120 in a minute, so they don't get confused, because it's difficult to time your compression. कि कब 1 minute हो गया, कब 18 second हो गया. So we will say if somebody is there to tell us, and we have to count. And in second compression, in second cycle, you did not start immediately counting your compression. You took some time before you started counting. Okay, that was your compression. And of course, pocket mask everybody knows. And rescue breath, you were giving rescue breath. So that was quite good. Like she extended the neck. We always have to extend the neck before you give rescue breath, because the trachea has to be open in a straight line before we give the rescue breath. And the ambulance crew who applied the AED.
Yes, sir.
So you were looking after AED.
Yes,
so how was your experience? ठीक लगा?
Yes, sir.
Now you are confident?
Yes, sir.
So the purpose of this simulation is like we transfer this learning into our clinical practice. So next time if the patient comes, then I think we will perform in a much better manner as a team. Because when real patient comes, then it becomes very chaotic. Even in hospital also. So the purpose of this simulation is that we learn these techniques and transfer these techniques into our clinical practice. And this is the basic purpose. And if they make mistakes, then it's okay, because we are learning. We are not here to, perform perfectly in simulation. But in clinical practice, when we are looking after a real patient, we need to be perfect. We need to, minimize our error. So the simulation is a great tool for learning these skills. And VERVE Medisimuhub is the first Indian company which is making mannequins and also promoting simulation education, because through simulation education we can make our patient care more error proof, and we can hope for better outcome, and we can be a good clinician, we can be a good paramedic also. So thank you all for participating in simulation, and see you next time.
Thank you, sir.